I'm a physician scientist, and I spend most of my time thinking about how to prevent cancer, and specifically how to prevent blood cancers like acute leukemia. The people who are diagnosed today with acute myeloid leukemia, in 5 years, 70% of them will have died of their disease, and only 30% of them will still be alive. And that is just not acceptable to me. Before patients get leukemia, there's a fraction of patients who have what we call clonal hematopoiesis. And so this is a type of precursor state or a pre-leukemia state where we can detect it using simple blood tests. I was put in charge of developing this CHIP clinic. A lot of what we've done with our CHIP clinic and how we've designed it is really centered around the patient experience. And the patients that we were seeing were asking, what is my specific risk for developing a blood cancer? A few years ago, we created a risk calculator that actually takes patient information, so what mutations you have, what your blood cell counts are, and it can actually put that information into this calculator and figure out whether or not a patient is high risk for developing a type of blood cancer, intermediate risk, so in between, or low risk. Our high risk population, we say that those patients in a 10-year period have an over 50% chance of developing a blood cancer in that time. Versus our low risk patients, if we follow them for the same amount of time, less than 1% of them will develop a blood cancer. The biggest way that folks are incidentally found to have CHIP is they go to their primary care doctor, they have routine blood testing done, and they have either a high or a low blood count. Our CHIP clinic is both clinical, but we're also doing research at the same time to really understand what interventions might be the best for this population. So I think that Dana-Farber has really centered cancer prevention as one of the next frontiers in cancer therapy. Coming together and learning from each other is really an effective strategy for moving the field of cancer prevention forward. And Dana-Farber has been just a really special place to do that.